Welcome and thank you for standing by. Currently, all participants are in a listen-only mode. Today's webinar is being recorded, and the recording will be posted publicly. If you have any objections, you may disconnect at this time. Now I'd like to turn the call over to your host for today, Crystal Jimerson.
Hello, good afternoon. Welcome to our webinar on exploring the world of census health-related data. I'm Crystal Jimerson, a training specialist here at the U.S. Census Bureau, and I want to thank you for joining us today for the Topics, Tools, and Data to Use webinar series. These webinars are a great opportunity for you to learn from our experts about how to access the Census Bureau data, tools, and resources. If you wish to follow along, take a moment now to open an additional browser. You can also register for any of the webinars by visiting census.gov/academy. Before I introduce today's speaker, let's go over a few important housekeeping rules. As mentioned earlier, this webinar is being recorded. For your convenience, it will be uploaded to our Census Academy site with all supplemental materials relating to the webinar within 30 business days. We welcome written questions during the webinar. Please submit your written questions using the Q&A panel, which is at the bottom center or the right side of your WebEx screen. Please take a moment to locate that now. Once you found the Q&A panel, make sure you choose All Panelists from the drop-down menu. This will ensure we see your question. Also, we ask that you do not include any personal or business identifiable information with your questions. We suggest keeping the chat panel open as we will provide key links and other resources throughout the webinar. Keep in mind you won't be able to respond to the chat. That is for us to send out links and other resources related to the presentation. My colleagues will be monitoring the Q&A panel. As time allows, we will answer your question directly through the Q&A panel, or we will share your question with the presenter to respond to during the webinar. If we do not get to all of the questions with a response during the webinar, we will post the questions and responses with all the webinar materials on the census.gov/academy site within 30 business days. As you know, we are in a virtual environment and sometimes technical difficulties might occur. If you are having issues, try a different browser such as Chrome or consider logging out and coming back into the session. If you are having audio issues, try selecting the computer audio or calling into the webinar via phone. Now I would like to introduce our speaker, Kira Obradovich. Thanks again for being here today. Kira, you may begin.
Thank you so much, Crystal, and hello and welcome everyone. I'm going to be presenting today on really the whole world of census health related data that we have at our fingertips. My name is Kira Obradovich, as I said. I am a data dissemination specialist with the U.S. Census Bureau's Data Dissemination and Training Branch. And I have worked as a DDS for several years and formerly worked as a senior partnership specialist, all within the Chicago region. I currently serve the city of Chicago, several of our areas of our county, Will County, and the states of Iowa and Missouri. And there are data dissemination specialists that cover every area of the United States. So please definitely reach out if you have any need for training or you have any data questions. So we are going to go through a brief interview about this overview of the Census Bureau itself. And then we're going to look at some key health related surveys, some key health related geographies, as well as some key topics. I know that some of you have been participating in other Census Academy webinars prior to mine. So I did want to let you know that some of what I might cover might be a little advanced, but when you go back through and look at those other webinars and watch, you're going to get steps to get to where we are today. I'm going to cover two primary tools, data.census.gov, and show you how you can filter, how you can build your own service area if the geographies don't match up to what you need, and then also pull data from both the American Community Survey and the Household Pulse Survey. And then I'll go into our microdata access tool. There we have data from our American Community Survey, current population survey, and our survey of income and program participation. And I'll show you how cool this tool is to allow you to create your own cross-tabulated tables. And then finally, I just wanted to mention an upcoming webinar and our Census Academy. And if there are time for questions, I will be happy to take them. So the U.S. Census Bureau, we're the largest statistical agency in the United States. We conduct more than 130 surveys and programs every single year, and that data is used to disseminate over $2.8 trillion in funding. And we are focused on making sure that everyone's data is private. And then we are also focused on making sure that our partners out in government, in business, in nonprofits, all have access to data that can help them in their planning and their own work. And that is why today I'm hoping to introduce you to a little bit of the world of our data. One thing, though, that I know that I struggle with even working at the Census Bureau, and that I'm assuming many of you that have started to work with our data, is trying to figure out which topics exist in which survey. Because we have over 130, sometimes it can be difficult to figure out which one we need to use. So I have created a little chart here. This will all these slides will be uploaded online as well as the recording. So you will have access to this, but this is just going to point out some key health related data that you might be interested in, and it will show which survey has that available. I wanted to touch just a quick touch on the American Community Survey. This is our largest demographic survey. We conduct this and we look at 3.5 million addresses every single year. We also publish this data in one-year estimates for geographies that exist that are above 65,000. And we also have some supplemental for those that are 20,000 or more, and those are for our one-year estimates. So they're our most recent data. And then we have our 5-year data. And those estimates look at a period of 5 years and then are able to produce data that you can look at for smaller geographies, as well as really when you're honing in on smaller communities. That 5-year data can be really important because it's going to give a much larger group that you're looking at, that 3.5 times 5. So there's definitely different reasons. And if you ever need any help, please reach out and let us know on deciding which estimates to use. Then we have our Household Pulse Survey. This survey was brand new in 2020. It was created because we needed real-time data on what was going on in our society during the pandemic. And it was a 2-week data collection period that continued to be published almost, compared to the other surveys, almost immediately. So within the next month, it would come out. And it introduced some brand new and expanded questions, especially those that are really key to health. So it asked some questions about mental health. It asked about the ability for people to be able to afford their medication, asking them if they'd avoided, perhaps seeking treatment because of that. So it's got some really key data points that I encourage you all to look at. It is published at every state level, and it does go down slightly smaller, but only to the 15 largest metropolitan areas. So we decided that this worked so well that we wanted to turn this into a permanent survey. So Household Pulse has now become Household Trends and Outlook Pulse Survey. It's already begun. We already have our February to March data available in our public use files. And I do hope to see that added to one of our tools soon. And I'll show you where we can find that HPS data soon. Then our current population survey, which you may have heard about, it's one of our oldest surveys. We survey about 60,000 households every month, and this data is used in a variety of ways, but that we have a number of supplements, including an annual social and economic supplement, and that's used actually to calculate the supplemental poverty measure for the United States, and it includes some information on health insurance. So if you are looking at this, state level data is great with this, but there are some limited counties. And then our survey of income and program participation. So this is a longitudinal survey. We follow people living in households rather than the addresses themselves. We follow them over the course of about 4 years. And then we're able to see how well government programs work, how well some of the work being done by healthcare organizations are working. And then we publish this at the national level. But this does provide some very specific information about conditions and things that might contribute to disability. And it really, if you are interested in some more of this data, you can apply, depending on the organization you are, to access some synthetic data that might be available at smaller geographies. And there's a link in the chat that should allow you to do that. All right, so those are our 4 surveys, and I know that might have been a lot, and please bear with me. I'm going to just do a little intro to geography. Several of my colleagues have done some great Academy Series webinars earlier this year on smaller geographies and larger geographies. And you may have seen a slide like this, but this slide breaks down the way that census geographies work. We divide the nation into states. that go down to counties, to census tracts, which are those areas that have about an average of 4,000 people, all the way down to census blocks when we do our decennial count. Block groups are for our American Community Survey. It's the smallest geography that is available there, and those are for estimates. But today I really wanted to highlight three sort of maybe lesser known geographies, but those that are very important, I know, for many of the health partners that I've worked with. So we have a number of metropolitan and micropolitan areas. And the reason I'm mentioning that is because that data from the Household Pulse Survey is done by that. And those areas are divided up from the nation level. That is the same as the zip code tabulation areas. Zip code tabulation areas are similar to zip codes. They come from the national level as well. That's because some zip codes cross state lines, right? They cross counties, they cross places. And so we have to divide those up from that level. And then we have our PUMAs, so our public use microdata areas. These are areas designed by and with each state, and we work to make sure that they're going to be useful geographies for them, but they do contain 100,000 or more. And then we're able to publish microdata that's available in the tool that we'll look at today, MDAT, and you can create your own tables and really hone in and use a lot of variables to create a universe that it really can't be created in anywhere else. So those are the three that we're going to kind of focus on. I do want to hone in a little bit, though, on the difference between zip codes and ZICTAs, because many health organizations I've worked with and many other federal bureaus use zip codes. That's a common geography with health data. So zip codes are geographies that are based on postal routes. They're not something that's built up from the ground or from the top down like the Census Bureau does with our geographies. They are things that can be changed depending on the need. And so because of this, those borders and those boundaries of those areas are going to impact the data that we are able to produce. So what we do is after each decennial, we update our zip code tabulation areas to match the zip codes that are currently present. And then for the next 10 years, they exist as they are. So they're stagnant and you're able to compare data over the years. For the most part, in most instances, they are identical to ZICTAs. So I did want to let you know that, though, just in case you are looking at a project with ZICTAs, we do have some crosswalk files available, but you're also welcome to reach out to us and our geography team if you have any questions. And then our public use microdata areas, there's a map here of the state of Iowa. I just kind of wanted to show you how this works. Because they have to have at least 100,000 people in some areas of every state, there may be more than one county involved in that area. But in urban areas, for instance, sometimes you have more than one in that urban area. We update these just like ZICTAs after each decennial. And we really do try to work hand in hand with those states and the state data centers to make sure that they're relevant and they're available. And really, I think you can find a lot of creative uses for them, even like between looking at urban and rural areas, they each have some unique uses for each. Now, this is an example of one of the slides that I have a number of others hidden that you will be able to access online that I didn't quite have time to go through all of them, but I wanted you to have for later reference. So these tools that we use for the census for a lot of this data, I wanted you to understand just right off the bat, what is the smallest geography that's available? And I had mentioned, block groups for the American Community Survey that in data.census.gov, for instance, the current population survey has national level data, but in MDAT, we actually can get further down. So that's just for your use later. All right. So as I mentioned today, we are going to go through two tools that we often train on. One of them or both of them may be familiar to you, but the first one that we're going to look at is data.census.gov. And we are going to go ahead and go to Google because data.census.gov, the name of it is the URL. So you're welcome to open up a browser if you'd like and follow along. But you can go ahead and type data.census.gov and you will always see this blank start page where it says explore data. You'll notice on here that we have a search box. We have an address locator pin, and then underneath we have a link that says advanced search. If you're brand new and you're just exploring the tool for fun, I encourage you to use that search bar. But if you have an idea of the data you're looking for, I do encourage you to click on advanced search when you get here. And the reason that I suggest that is because when you go to advanced search, you are going to get a clean slate. We're in a clean tool right now. So I went to data.census.gov and I clicked on advanced search in the middle of the page. We're in a clean tool and we're over here and we see that there's 0 filters so far. So this tool works with filtering on the left-hand side for the most part. And you can filter by geographies, by topics, by surveys, and by years. And then if you're looking at our econ data, you can also sort by codes. We do have several geographies listed here that are going to always stay no matter what filter you've used, because these are our most popular geographies and you might want to check them out. But if you want a picture of all the geographies that are available on this tool, you can go to all geographies, which is on the bottom of that. And you can note here that these are all of the geographic entities that exist in this tool for any number of days. You also have at the top, you can switch over to summary levels. And these are just the way that each of these are broken down. So if you're trying to look for census tracts by county, by state, or you want state to place, this is a way that you can do that as you're playing around. But for the most part, when you get in here, you'll probably know, for instance, I want to look at a school district. So in order to find that, I would go to that all geographies under the geographic entities, and I would be able to type in to search, and I would see that we have elementary, secondary, and unified. So if I was looking for a school district that was unified, I could go ahead and click on that. You'll see that they're broken down by state. And I'm going to go to Nebraska here. And when I click on Nebraska, I'm going to see all of the school districts that are in the state. I can do that search again for my place. So for instance, for Omaha, I can go ahead and find it. And once I've found what I need, I can go ahead and select it. You'll notice that every time we select a variable in this tool, it will show up on this left-hand filter in my shopping cart up here. And it's easy to clear all of them. It's easy to X out of them if you've made a mistake. And so this is a really handy thing, because after you've entered in a filter of any sort, it's going to, for instance, remove the surveys that don't publish data at that geography level. So we see here that there were more surveys initially, but now that I've added a geography, it's really highlighting that we primarily have surveys related or data related from the ACS, the decennial, and public sector surveys. So I'm going to go ahead and clear out of this though, because today I want to focus on looking at an area in Detroit. And I'm going to talk about what if you tried out some data for the city of Detroit, you weren't necessarily super familiar with them, but you wanted a certain area. All right, I think we are back. Okay, great. I apologize. Okay, so advanced search. We're back at that main screen. We're going to go to the zip code tabulation area on the left-hand side of the screen under geographies. And really, I do want you guys to remember that when you start off filtering, yes, I'm frequently showing you geographies, but really you just want to start with your non-negotiable. So whatever it is with the data you need, be it the year of the data, be it the survey, or be it the topic, you can always start with that to filter out everything else. So for zip code tabulation areas, because we know we want ZICTA data, we're going to note that when we go here, it shows all the states, and we're going to go to Michigan. We can use this search bar, which is very handy up here. And we'll give it a minute and you'll see that it's going to load. You can either select specific ZICTAs or you can go ahead and select all. But I don't want all the ZICTAs for the state. I want all the ZICTAs for Detroit. So we have this cool feature. If you get stuck like this and you're like, oh no, I need it just for the place. Check and see if we have it available. And you can do that by clicking on this within other geographies just above. You'll see a little plus sign. Then you'll note that we can actually get them by place. So if you go ahead and click place, now it's going to show you all the places in Michigan. So I can go ahead and search for Detroit, select Detroit, and now I can do all of them, or I can do individual ones. So I'm going to go ahead and select all of them, so we can get a picture of the whole city, and I can show you that there is data available. There is a lot of data available. Once I put my geography in, I can go ahead and either click search or I can click tables. I like to click tables because it takes me directly to the tables that are there. So tables at the top of the screen, I go to that tab and you can see it pulls up that we have over 2,500 tables that have data for all of these ZICTAs in Detroit. But I wanted to look at income and poverty, or I wanted to look at housing. If I wanted to look at a different topic, if I wanted to see what we had available for health, I would scroll down here on the left and click health. And I would note that we have tables on disability, fertility, health insurance, and tables on health expenses. Under housing, we actually have places where you can go and find data on who rents, who owns, if there's access to internet, as well as if there is transportation and how many vehicles, for instance, and what vehicles are used within that category. So I suggest checking all of these out and becoming familiar with them. But each time I select one of these, it's going to filter out the tables that meet that criteria. And you'll see here then, for instance, now we have 1,345. Okay, so let's say that I do not know the ZICTA I need or the zip code I need. I know where the address is where I'm working, and I know that I want to build on that address and create a service area. But because census geographies do not cover full neighborhoods, right? So in Chicago, we have 77 neighborhoods that are official for us, but the census geography does not match that. Well, in Detroit, they also have districts. So let's say that I was trying to find data for the entire East Riverfront District of Detroit. What I could go and do this time then is use the address lookup feature. You can do that by going in the upper left-hand corner again, clearing everything out. And now we are back on the main page. And we are going this time to this little address icon. Go ahead and click on that. And you'll see here that we can enter in an address. And I'm going to use 3600 Heidelberg Street. If you are familiar with Detroit, you may know the Heidelberg Project, which is a really cool art installation right here. And it's a part of that East Riverfront District. So I can type in the address and the city and the state. And then I can go ahead and click search. And the really cool part about this is once I put in an address, I can see all of the official census geographies on data.census.gov that will have data at that level for one of the surveys, at least. So for us, we're seeing here that this is immediately pulling up the zip code tabulation area of 48207. And if I click on any of these hyperlinks next to these geographies, it's actually going to auto load it into my filter so I can start from there. So I'm going to go ahead and click on the zip code tabulation area. And you'll note now it's up in my cart, it's up in my filter. And now I'm going to we have a map feature. We have tables for it, but we also have a map feature. So I'm going to go into the map feature. I'm going to use the little chevrons that are just next to the map, just to the left of it, to click over. And you're able to see here now that I have one census tract highlighted, that 48207. Then I can go ahead and zoom in to see a little bit more. And I note that, there's not a lot of detail here. It's kind of hard for me to know what's here. Well, luckily, we have different base maps available up at the top here. You see the word base map. If you click that and you click detailed, you'll note here now it's starting to put some more information here. I can see where I-94 is. I can note here that Grosse Pointe Park and Grosse Pointe neighborhood start right up there. And I can even zoom in here and see that this is Belle Isle, which is another lovely area to visit if you are in Detroit. But I know that the East Riverfront District goes between the Heidelberg Project, where that is, and Grosse Pointe. So I want to add these other two ZICTAs in. Now I can go back to what we were doing on the filters and I can search for them and I can add them and remember the numbers and all those things. But the easier way of doing this is to simply select them on the map. So I can go ahead and click on any ZICTA in the United States that I want, but obviously I'm doing the neighboring ones here. And a box will pop up. And if you click the word select, it's going to add it to your geographies. And you'll notice here now on the left-hand side where filters are, I have 2. That's because it's added that other ZICTA. I'm going to use my chevron again to move back over. And then we can add in our third ZICTA. We can select that. If we've added one that we don't want, we can also easily click again and deselect to take it off. But these are the 3 that I want to look at for the East Riverfront District. So now I'm going to go back over here to my filters now that I have my geographies loaded, and I'm going to look at topics because I'm hoping to find out some data on poverty for these areas. So when I scroll down and I look at the topics, I see that we have income and poverty, and I'm going to select that. Now, under each topic, there is a identical box to check, and that just means you're getting the most general, all the responses that could be related to those topics. But if you know that you want to look specifically at SNAP, food stamp information, you want to get tables specifically on earnings, or you want tables specifically just on poverty, you can always go ahead and click these tables. But when you're discovering a new area and new data, I do encourage you to look at everything that's there, because sometimes you'll find stuff you don't realize exists. So go ahead and select income and poverty. Now that I've done that, it's further filtered down, and you'll notice that now we have 592 results for the tables. I'm going to click that little X. Also, never be scared to click on chevrons or big X's, because they're not actually closing anything, they're just moving things over. So now we're going to look, and we see that there are quite a few results, but right up top here is 71701, which is poverty status in the past 12 months. So this is going to give me the data that I might need for poverty status. I'm going to chevron over here, and I can see this is looking at our map. And then I'm going to go over to my tables. I just want to show you that it also maps everything. And I'm going to note here now I have my 71701 poverty status in the past 12 months. And over the top of the screen, in our columns, we have each of our ZICTAs. We have totals, we have margins of errors, we have those that are below the poverty level, and we have an estimated number, and we have percent below the poverty level. If we don't need our margin of error, it's pretty easy to take that up here on the top of the page. You'll see margin of error, you can just deselect that. And if you want to download this data for comparison or any other reason, you can easily go to more tools and you can download. It will auto create citations for you. You can share it, you can print it, you can pull it directly into our API, into our more raw data, and you can chart it, as well as I showed you, you can map it. But today we're trying to look at what the changes may have happened over the past 10 years. And you'll see that even in this data, in this table, it's not just poverty status. We're going to get data on race. We're going to get data on educational attainment, on employment status, things that might impact health outcomes and things that might impact poverty. And so that's a great, I love this about DCG because there are just tables that have more than the one thing you're looking for. So you'll discover a lot of new data. So up here at the top, we're going to note that for the population for whom poverty status is determined in these ZICTAs during 2023, we see up here, we've got our 2023 ACS 5-year estimates because ZICTAs are under 65,000. We see that we have about 28%, 29%, and about 39% for those three ZICTAs in 2023. So what if we wanted to look a decade ago and see where we've come and what has happened during that period? Well, we can go ahead and go to the little drop-down arrow in the upper left-hand corner under the title of the box, and we can select 2013 ACS 5-year estimates. So this is going to show you all of the survey data that's available for this table. And when we pull up 2013, it's going to stay right there. It's just going to refill itself. And we can notice immediately that there were some big changes in these areas, right? Because this ZICTA, where the Heidelberg project was, is 43.6% from that 28. And we scroll over and we see 39 and we see 46. And we can go and we can download this and we can look at all the differences between the two. So I hope that gives you a little picture of how to look at American Community Survey data here. I also wanted to show you how to view the Household Pulse Survey data. And this is key because the Household Pulse Survey data looks a little bit different in this tool. And I don't want you to be overwhelmed when you get there. But we're going to clear everything out again by going to the logo in the upper left-hand corner. And we're going to go back to our advanced search so we have that clean slate. Then on the left-hand side, because I know that my non-negotiable is the survey, I'm actually going to start out by selecting the survey as my filter. So I'm going to scroll down here. And I'm going to note that under surveys, I see Household Pulse Survey. Household Pulse Survey technically does not have all the tables that the American Community Survey does. Instead, there's one for the coronavirus pandemic and recovery and one for high frequency social and economic data. We're going to look at the high frequency social and economic data today. So I'm going to select that. Once I select that, you'll note here, it's filtered out all the surveys. It's filtered out all of the years that are not available. It's also filtered out some of the topics that are not included on that survey. However, you will notice whenever you filter by anything else, this geography stays stagnant. So I get excited sometimes when I do this. I click, oh, I can get it by the county. So I click on the county and I see no results found. But rather than going through each of these individually to discover which geographies are available, there is a trick. You can go down to that all geographies that I showed you earlier, and you can go up to summary levels. When you get to summary levels, it's only going to show you what's available. So we can see here that we have it at the United States level for our nation, we have it in each individual state, and we have it for metropolitan statistical areas. And you know, because of earlier and the chart you'll have from me, that there are only 15. But when we select that, we'll be able to see the 15 that are available. And so we're going to go ahead and click on Chicago. And then we're going to go ahead and go over to our table. So we can go up to the top and click on tables. We can use that chevron next to the table to the left to move it over. And now we can see that we have all the data for this table. It's a very large table. There's 117 entries, pages on there. But we have data now from all of the household pulse survey on a variety of questions. So we talked about how there's information on here about, mental health. We talked about the impact of being able to afford medications or food scarcity. There is a wealth of data then that is available. This data is also able to download. And the cool thing about all of these things that I'm creating, at any point when you're working on something, you can copy paste this URL at the top of the page, and it's going to copy paste, including all of the filters you've already put in. So if you've built a territory with that map and you want to save it because you've entered in, little census tracts and created a whole neighborhood, save that URL, because that will allow you to simply copy paste again back into a browser and bring up the exact same thing again. And we've found this has been very handy for people that do need to create their own service areas. All right, so that is it for data.census.gov today. I'd like to start showing you MDAT, which is our other tool. And to get there, you actually can go back to the data.census.gov page. It's considered an app for this tool, but it is a tool in its own right, and you will see that soon. So just to the right, we have up in the corner apps. So you're going to go ahead and select apps. That's going to take you to our population pyramids on the right, but then it's going to take you to our microdata on the left. You're going to go ahead and click on microdata. And you're going to pull up a tool that's going to remind you a little bit of data.census.gov. But the key thing with MDAT is that because there are limited geographies, you do not need to worry. Your non-negotiable here will be your survey. So if I'm coming in and I want to create my own table for a survey, I'm going to go ahead and look at what's available. It defaults to these ACS 1-year estimates, but we have our Puerto Rico public use microdata sample for 1 year. We have our 5-year estimates. We have current population survey. So I talked about that ASEC supplement that has data on health insurance. We have a basic monthly. In the past, we've done different supplements. That data is all available in this tool. We also have our survey of income and program participation available as well. And so this is a wealth of information that you can use. And in the chat, you should see what we're going to be looking at today on MDAT is what if I had, what if I wanted to look at creating accessible marketing and materials for people living in the city of New Orleans who are blind or visually impaired, and I want to take into account what languages they may speak. I just want to show how far in you can hone in on your populations by using PUMAs. So we're going to start out by using those 1-year estimates simply because at the moment I'm just looking for the most recent. However, I do recommend checking both the 5-year and the 1-year when you're honing in, because sometimes that 5-year, because there's so many more addresses, might give you a little bit bigger picture. But we did 5-year on the last, so I wanted to show you 1-year estimates here. So we're going to stick with our 1 year. We're also going to stick with our 2023 data for now, although next month we will be releasing our 1-year estimates. So we're going to go ahead and click next, and that's just going to move us to a different tab. Great part about this tool is you can go between any of these tabs at any point. You're not going to mess anything up. You can go back and edit as much as you need to, but when you do click next, it will take you to the variables tab. Even if this tool ends up being something that you can't use, that you don't want to use, I do encourage you to come here and check out the variables tab for each survey, because this gives you a great picture, not just of the different variables and topics we have, but the way that we word it, which is really important sometimes when you're searching for data. So as you see, when I go through here, we have the phrases that we use to number all of these things under label. And this value count to the right is actually going to tell you how many potential responses there were for the person taking the survey, which means that over to the left under variable, if I were to, want to know, for instance, how did we ask the units in a structure question, right? What were the potential answers? I can click on the little drop-down arrow next to the BLD variable on the left, and I can note that these values here, these are the potential things that people were able to select. And the cool part about this is with this tool, if I want to create a universe of people, for instance, that live in one family house attached, in one family homes that are attached, I can do this later on in this tool. So, so this is really cool because you can, or I can look at more than one, or I can look at all, but it really allows you to tailor and customize what you're building. So up in this label box, we are going to look first, because we're looking for blind or visually impaired individuals. And I will say that usually when you start with this, you might start to type blind. Nothing comes up. You might then go to disabled instead. And as I'm doing this, you'll see that, yes, there is a disability recode, but there's only 2 values. So that it's either yes or no. And I'm specifically looking for vision. And I know that the American Community Survey does indeed have data on that. So the thing I want you to remember when you're looking for disability data is difficulty. That is the key word, difficulty, because the questions that we ask you if you have a difficulty doing something due to a vision difficulty, due to an ambulatory difficulty. So remember that when you're trying to look for those specific disabilities. On here, you'll note that we do have the vision difficulty. We can click on the little drop down to the left to see that the only 2 answers were yes or no. So we can go ahead then and select this to add it to our cart, kind of like we added things to our filter box in data.census.gov. So we'll go ahead and select that, and you can immediately see up in our cart, it shows 1. So now I'm going to use that label box search feature again to look for languages, because we're looking at household languages that might impact the marketing that we're doing in the area that we're looking at. So I'm going to type in language. And we can see here we do have household language, but it only has 6. And I'm looking for a bit more specifics. But those 6 with this are really more of the groups of the languages rather than the individual ones. But we also have detailed household language down here. And now I see when I open that up, it has 130 values. So this is going to give us some great information on a lot of different languages. So I've decided I'm going to add this to my cart, and I'm going to be able to get a picture of what languages are spoken. So once I have all of my variables in my cart, I'm going to go over to my geographies tab at the top of the page. And remember, with the public use microdata, the smallest geography that it's published in is our PUMA, but we do have it by region, by division of the nation, and by states. But we're going to show you the PUMAs today. So one of the states I wanted to highlight here today was Louisiana, and that's actually because when you select the state of Louisiana, you're going to note that all of the public use microdata areas for Louisiana actually have titles because they match things within the state. So they match planning commissions, they match different development districts, and this is going to then allow those regional planning organizations to use these geographies in a really great way to look at their areas. Now, there are a lot of PUMAs in Louisiana, as we can see, but there is a search box up here. So if you are looking at an urban area, of a metropolitan area, I do encourage you to search with that name, because we do put the names of the cities in. And you'll see here that as soon as I typed New Orleans City, Northeast, Central, and South appeared. So it appears that there are 3 PUMAs in the state, or in the city of New Orleans. So I'm going to select all 3. You'll note each time I do, they appear at the bottom of the page. You can easily deselect to delete, or you can click on the little X that's a part of each of the blue boxes. And you can see up here in the geographies that there are now 3 listed. The cool part about this tool is it will automatically show you a total of whatever grouping you've made if you're creating your own service area again like this. There is a group feature that I encourage you to look at later or have your data dissemination specialist help you that will allow you to change the way that it appears on the table. So after we've added in our 3 pumas, I'm going to go ahead and go over to the cart. When I get to the cart, this could be a little overwhelming at first, I do apologize, but you're going to see on the left-hand side, these are the 2 variables that we selected. We have the vision difficulty. If I select this one, we can see we have all the detailed household languages. Now I'm only looking for people who have vision difficulties, so I'm going to select that and I'm going to deselect the answer of no, because I only want those that said, yes, I do have a vision difficulty. And then I'm going to go back over to the left-hand side and I'm going to select detailed household language. And in this case, I want to know it all. So I'm going to leave them all selected because I want data on anyone who has a visual impairment of any kind who might speak another language. And that way I know what I might be needing to make for my marketing tools or my programming. If you have variables that are numbers like ages or amounts of money, income, there are ways of creating custom groups that allow you to tailor it to exactly what you need. So if you were, for instance, only wanting to know, females that made above $63,000 a year, or you wanted to look at how many, 18-year-olds make, 10,000 or 15,000, or, creating groups, there's a really cool feature here that will allow you to create those custom groups. And I definitely encourage you to look into it if you need specific information like that. But basically, once we've selected these variables, this has already created a table for us. And if we go either to view table or up here to table at the top of the screen, it's going to show us the table it's made. It determines where it wants to put columns and rows, but the best part is that we can actually edit it. So you'll note here that it's a little awkward to read this because these geographies are all listed out individually under each language. So this is a very large table. So cool part is over to the left, we can drag and drop anything we need to move between the columns and the rows. So right now we can see that the vision difficulty is at top, which is fine because that's the universe we want. We can move the selected geographies up to the columns from the rows on the left-hand side by just clicking and dragging and dropping. And we'll see here now still in our rows are all the languages. So here's where then we're able to note that as we scroll down, there are a lot of zeros in these totals, but of course it is New Orleans. So there are about 264 people living in New Orleans that have a vision difficulty who speak French. And there are about 1,171 total who speak Spanish. But as I was going through this and I'm seeing all these zeros, I'm noting that as I was going through this, I noticed that there were also 82 individuals who had a vision difficulty who lived in New Orleans who also spoke Vietnamese. So, and the other more interesting part is as you look over here to the right, these are each of those individual pumas. We can note here that there is a specific area of the city where these individuals most likely live based upon our estimates. And therefore, if I were serving that area, it might be a good idea to consider the fact that, large print or Braille in English might not be something that will be able to be used. And maybe you want large print in Vietnamese for that population as well. And maybe you want Vietnamese Braille. But a fun fact is that Vietnamese Braille is actually very similar to French. So if you don't have the ability to create Vietnamese Braille, but you do have the ability to create French Braille materials, then that might actually help. So I just wanted to kind of give you a picture of this, and you can hone in even more. You can go back to your variables. You can add in more information like age, any of those variables from the American Community Survey, up to 14. However, one caveat there, we can't drill too far down. So sometimes you're going to add in such specific things that when you get to your table, it's just going to show zeros or it's going to show X's. So definitely look around with that because sometimes you just drill down too far. But this table is great. You can download and share this in CSV or an Excel file. You can do the exact same thing as data.census.gov. You can literally click up here and you can copy the URL at the top of the browser and you can paste it, you can save it, and you can pull all of these as a query into API to get the public microdata that is available at API with these groupings. And that actually brings me to current population survey. So I showed you at the very beginning of all of this, and we'll go back to the first page, this data set, but I'm gonna clear out actually real quick. So we can clear out again like we did with data.census.gov. go up to the logo in the left-hand page, navigate to that apps in the upper right-hand, and then down to the left, click on microdata. Now that's cleared out everything that I put in before. If you talk to current population staff or survey staff, they actually will recommend that you use MDAT to pull API because it gets that query for you really easily. But so you can look at that within our API, or you can obviously look at that data within our tool. So CPS is here. You'll see that then, you have different vintages, you have different years from what you're looking at. Some are annual, some are monthly. So we have, every single month. And then of course, the latest SIP that we have is all the way at the bottom. And that's that 2023 data. Okay, so those were our 2 tools that I wanted to go through today. And then I really wanted to just give you a little overview of how do some of the health organizations that I've had the pleasure of working with, how are they using our data, right? What are they doing with it? Well, we do have a county health department that's using that data, that social and demographic data from the American Community Survey, to actually use in real time for their community health workers. So as they're driving and walking around, they've created maps with all of this information so they can know where they need to target and also be able to complete their environmental scan that they were working on. And then we have, for instance, an epidemiology department that's using census data to create programming, to determine where to market the programs and how to really reach out to single mothers with young children. And one of the coolest things that I think is happening that I got to help on were there are tech companies right now that are designing apps for care providers so that they can use census data at the bedside when, like, in real time while they're creating care plans and they're saying, okay, you need to do A, B, and C, D to treat whatever health condition you're having. They're able to have the knowledge of what health-related data and what health-related topics, what things are causing them to maybe not have enough money. They might live in a food desert. How can I best design a care plan based upon where they live? And so they're relying on census tracts and ZICTAs, depending on what they're creating to do that. And I just thought that was a really cool example of how you could use our data to create a better care plan. And I did want to give a shout out to our 1-year estimates that are set to be released this fall. We have a pre-release webinar that I'd love to encourage you all to sign up for. You can register for it in the chat. We have a great ACS team and they'll be doing that on September 4th. And you're also going to be hearing some updates to things as well. So I definitely encourage you to tune in and check out the website that they have where they post their updates. That's also in the chat. As I mentioned, I am part of the data dissemination and training branch. We are here to help you. We create tailored trainings for you. We are here to answer your questions. We have online short and long training videos. And then of course we have our Census Academy, which is what this is a part of today, which creates these really great series that focus on different things that we know that the public has been looking to find. So definitely reach out to them, census.askdata@census.gov. And let us know if you have any interest in a training or want to know any more information. So I will see if there are any questions that any of you have that I can answer for you.
Hey there, Kara, that was great. No specific questions. Actually, Shannon just came in and chimed in. Maybe you could answer this one. I think Mac answered it, but for you, will there be a separate pre-release webinar for the 5-year?
That's a great question. I don't know that yet, but I would encourage you to look at that website where they do put out their updates because they should post that if that happens. One thing to note that the 5-year are released in October typically, and the 1-year are typically released in September.
That's great.
And
reminder
go
to
check that later. Sorry.
Yeah, that's great. And Shannon, please visit our Census Academy website at census.gov where you can sign up for our listserv for any upcoming webinars. Other than that, just a general reminder to folks on the call, if you joined for professional development, as Lisa noted, there is a survey after this webinar, and perhaps that can be useful for confirmation of attendance. Thank you, Misty. Great presentation. Just one last one for you, Kira, if you could address it. Is it possible to look at all food deserts in North Carolina? Food deserts.
So you would be able to look at North Carolina like at a smaller level. So if you wanted to do North Carolina, for instance, by ZICTAs or by census tracts, you could look at where there were issues with access to food or especially with the state level, you would be able to get the whole picture with HPS, with the household pulse survey data. So if you went back into data.census.gov and you chose the state level, after you select household pulse survey, go to the state and then click North Carolina, and that will then just show you all of that different data, the food scarcity, all of those different data points from the household pulse survey will be available.
Thank you, Kara. And a reminder to folks on the call, if you ever need specific training, please reach out to Kira or any of us at the Data Dissemination and Training Branch.
Great. Thank you
Kara.
all so much. Have a good one.
Great. Thank you. Thank you, Kara. Thank you, Andrew, for those questions. Before we conclude, we want to thank our audience for spending your time with us this afternoon. We are interested in hearing from you on how we are doing, so please take a moment to fill out the evaluation that will appear when you exit the webinar. And also, today's presentation is already posted on the Census Academy site, so you can take a look at that. That does bring us to a close. We thank you again for joining us today, and we hope you have a great afternoon.
This concludes today's webinar. Thank you for your participation. You may disconnect at this time.